Good morning, Juicy, or afternoon whenever you read this, or view it perhaps. I am talking to you guys about the thyroid gland, which is located right here in front of the, or below the larynx on either side and in front of the trachea. And I have to hold him because he might fall over. And it is one of the largest glands in the body, which I didn't know until I did this research, which I thought was kind of interesting. And it controls how quickly the body burns energy, and it also makes proteins. It regulates our body metabolism, blood calcium levels, energy, excess fat, hormones, oxygen, and weight loss. And it's controlled by the hypothalamus and the pituitary. It produces three glands, the thyroxine, which is also called T4 because it has 4 iodine atoms, triiodothyronine, also known as T3 because it has 3 iodine atoms, and calcitonin. So the T3 and T4, they regulate metabolism of carbs, lipids, and proteins, increase rate at which cells release energy from carbs, increase the rate of protein synthesis, stimulate breakdown and mobilization of lipids. Major factors determining how many calories the body must consume at rest in order to maintain life. And I thought that was interesting because it's the BMR. And I remember in pre-nursing or at the beginning of first semester, we couldn't figure out what BMR was. That's what it is. It's essential for nervous system maturation. It regulates growth, allows organisms to grow and reproduce and maintain their structures and respond to their environments. Made synthetically to treat thyroid disorders such as hypothyroidism and hyperthyroidism, which I'll talk about in like 2 minutes. Affects body temperature, growth, and heart rate, and iodine is an essential component of T3 and T4. And just a little note that I forgot to say earlier, triiodothyronine, the T3, is similar to thyroxine, but it's 5 times more potent and produced in smaller quantities. Calcitonin. It regulates concentrations of blood calcium and phosphate ions, inhibits bone resorbing activity of osteoclasts, increases kidneys' excretion of calcium and phosphate ions, which lowers these concentrations. So hyperthyroidism, which I'm sure you've all heard of, is overactive tissue in the thyroid gland. So there's too much T3 and or T4 hormone produced. So it speeds up various body systems. So symptoms of hypothyroidism are fast heartbeat causing palpitations, fast nervous system and tremor and anxiety symptoms, increased digestive system in weight loss and diarrhea, heat intolerance, nervousness, insomnia, breathlessness, increased bowel movements, light or absent menstrual periods. Oh, to have hyperthyroidism, fatigue, fast heart rate, trembling hands, muscle weakness, warm, moist skin, hair loss, and staring gaze. It's caused by Graves' disease, which is an enlarged thyroid. So if my little man had Graves' disease, he would have a bigger thyroid, okay? But he doesn't have Graves' disease. Oh, one ball fell. Okay, so or it can be caused by a single nodule within the thyroid instead of the entire thyroid. Or it can be caused by inflammation of the thyroid gland called thyroiditis. Can lead to release of excess amounts of thyroid hormones, which are normally stored in the gland. So, or if the client takes excessive doses of any thyroid hormone. So treatment for hyperthyroidism, for clients with temporary forms of hyperthyroidism, they can take beta blockers, which may be the only treatment required. There are meds available to treat hyperthyroidism, but if you stop taking the meds, then the condition could recur. Radioactive iodine is most widely recommended. This treatment takes advantage of the fact that thyroid cells are the only cells in the body which have the ability to absorb iodine. So by giving this this iodine gives off poisonous type of radiation, the thyroid cells will absorb it and they will be damaged, but no other cells in the body will be, which is kind of good. Actually really good to maintain life, but whatever. Another long-term cure for hyperthyroidism is to surgically remove part or all of the thyroid. So, surgery. Now he doesn't have hyperthyroidism. And hypothyroidism is the body lacks thyroid hormone. So signs and symptoms of that are fatigue, weakness, weight gain, or increased difficulty losing weight. Coarse, dry hair, dry, rough, pale skin, hair loss, cold intolerance, muscle cramps, muscle aches, constipation, depression, irritability. No, I don't have hypothyroidism. Memory loss. Maybe I do, Juicy. Abnormal menstrual cycles, decreased libido. So, if you have this, the treatment is thyroxine, which can be prescribed as Synthroid and Eltroxin. Average daily dose is 0.125 milligrams. And if you OD on that, then you'll have symptoms of hyperthyroidism. Imagine that, eh? So, as I talked about the goiter, this is the goiter, right? The big thyroid gland. It's seen as a mass in the neck. Oh, is it just going to lay him down? So he doesn't fall. I have a couple pictures of that. So here, that would be a goiter. See it? Oh, sorry, Karen.
It's okay, got it.
And here's a picture of someone who has a goiter. Yeah, doesn't look too pleasant. So, there's actually a lot of not so nice goiter pictures on the internet that I found. And goiters can be caused by lack of iodine in our diets. And as Juicy said on the phone the other day, it doesn't happen very often anymore because our salt is iodized now. So we don't see it so much here. And goiters can interfere with breathing and swallowing, and it's common in women and adults. Imagine that, swallowing. So symptoms of a goiter: thyroid enlargement varying from a single small nodule to massive enlargement or a big lump in the neck. Breathing difficulties or wheezing from compression of the trachea. Apparently that's a rare symptom. Swallowing difficulties from compression of the esophagus, and neck vein distension and dizziness when the arms are raised above the head. And there's different tests and signs, so a thyroid scan, ultrasound of the thyroid, higher normal thyroid stimulating hormone, low or normal T4, normal or increased radioactive iodine uptake, low urinary excretion of iodine, antithyroid microsomal antibody. So treatment for this is hormone replacement, small doses of iodine to treat the iodine deficiency, eliminating or reducing goiter-producing foods or drugs for a sporadic goiter, so get it here and there, I guess. A large goiter that is unresponsive to medical management or restricts swallowing and breathing may require partial removal of the gland, so remove it. If only surgery was that easy. So that's all I have for you guys. Any questions? Comments?
Good job.
Bye, Juicy.